When we began our program, planning was actually 2007, 2008, and then we began the last half of 2008. There were already more than 30 guidelines that had been released. So the evidence was out there. We just needed to develop it in a way that could be utilized within a hospital system. There was a publication in Chest in 2001 by Dr. McCrory and his colleagues out of Duke University that did basically a literature search looking for the evidence for inpatient care for COPD exacerbation. And they evaluated all that evidence. And what they found is that the evidence existed for treatment of COPD exacerbation for the following cares: chest X-ray, oxygen therapy, bronchodilator therapy, systemic steroids, antibiotics, and non-invasive ventilation when required, aggressive use of non-invasive ventilation when required. Arterial blood gases was kind of on the fence. It fell into the pool of efficacy, but really we know that for most patients admitted to the hospital with COPD exacerbation might not need arterial blood gases. Certainly those that are leaning towards acute respiratory failure or have confusion or have real low saturation, shortness of breath, so on and so forth, we want to get a blood gas. So that fell into that pool. The evidence was lacking for sputum analysis. We know which bugs cause COPD exacerbation. We can treat them. We don't need a sputum analysis for that. However, again, COPD, other comorbid conditions, there may be an infection, a different sort of an infection causing exacerbations. So if it comes to that, the physicians may order sputum analysis, but if we know this is COPD exacerbation, no need for sputum analysis. We don't do acute spirometry in the hospital. It does not improve outcomes, and for both COPDers and asthma likely may exacerbate the problem. We don't use mucolytic agents, chest physiotherapy, methylxanthines, leukotriene modifiers, mast cell stabilizers. If the patients are on any of this at home, you may consider continuing that in the hospital, but to order for treatment of COPD exacerbation on the right-hand side, those therapies do not improve outcomes for these patients.